Dr. V, you know, you specialize in, I want to say sarcoma. Is that correct?
I do. Yep.
Yeah. So talk to us a little bit about that. Those who may not know what sarcoma is and types of cancer that is and where it's at and how that comes about.
Absolutely. And it's not just patients that don't know too much about sarcoma. A lot of other providers have never heard of it, and the reason is because it's a very rare type of cancer that affects less than 1% of all adults. And it's actually sarcoma is a general term that encompasses hundreds of different types of cancer that we all collectively call sarcoma. And these are cancers of the things that connect your body together and give you form and give you function. Things like your bone cells, or your fat cells, or your muscle cells, or cartilage, or any of the connective tissue, or the things that connect you together and hold you in place. And there are hundreds of different types, as I mentioned, and if you add them all together, it's probably 10,000 new cases per year in the United States. And so you can imagine that a lot of people just have never heard of this, or they don't even have a loved one or who's gone through it. And also before you meet me, you're searching the internet, and it's a really scary place on the internet to have a rare cancer because you hear a lot of stories that may or may not be true. Um, and so sarcomas are very different in some ways, and they're very nuanced in how we manage them compared to other more common types of cancer that patients and families might be aware of, things like breast cancer and colon cancer and lung cancer. And for sarcoma, it's really a team endeavor. I work very closely with pathologists who have expertise in figuring out what exact type of sarcoma is it, radiologists who are so good at telling me and the team where exactly it is and how extensive it is. Surgeons who are extremely skilled in removing sarcoma, because if you have a sarcoma in one place, the primary treatment, if we can, is surgery. Radiation oncologists, because they help the surgeon to optimize their care and also remove the tumor. And then myself, and so as I mentioned, I provide chemotherapy, but more generally, just provide support and education, with the hope that for a lot of sarcomas, we don't actually need to use chemotherapy, and we can get really good outcomes with surgery and radiation. But I'm always on the team, and I want to be a resource to patients. And if they do need chemotherapy, such as typically when it has spread to other parts of their body, such as their lungs, I'm there to help them through that journey specifically as well.